So we are live about to do laser tattoo removal. This is a tattoo that we have treated one time. You're looking at a photograph of it before it was ever treated. Today, after one treatment, we already have these results, and she is about to get her second treatment on this tattoo. The first step of doing this is going to be to get it numb to make it a painless procedure. So we'll let Alondra go ahead and start getting this numb. So Alondra is one of our laser technicians that does the actual lasering for us. And Bridget is our assistant cosmetic coordinator that also does some of our lasering, that's going to be talking about this with us today. So she has had one treatment, and as you guys can see, she already has excellent results. So Bridget, why don't you tell us about how many treatments to expect with the laser tattoo removal?
So for laser tattoo removal, we usually recommend around 5 treatments for a tattoo. Give or take 2 treatments. It could be gone in 3. It may take 7. It's one of those things, every patient is different, so it's kind of as you go. Whenever the patient is happy with their results is when we're done.
And after we get her all numb and we start treating her, what can she expect later today that her tattoo will look like?
So the first thing we see is almost like a frost. So with the laser, it causes the tattoo to break down. Her skin may blister or peel. We have a way to make that a little more bearable by keeping it very greasy with Vaseline, keeping it from getting a scab, and that can go on for about 2 weeks or so, but it'll get better and better as it goes.
Great, and I think we actually have a picture of what she looked like after her first treatment, and I'll show you guys that. So you can see her blistering had started to heal, but that the tattoo was still pretty irritated, still red, and a little bit bruised. There are a few contraindications to having laser tattoo removal. Bridget, why don't you talk about those?
So we don't want anyone who is pregnant to be getting a laser tattoo removal, or anyone who is tan, because the tattoo can cause a scar to discolor. So we steer clear of anyone who's gotten a darker tan than usual. As you can see, she's starting to get all numbed up. You can see we use lidocaine and epinephrine, which is why you see this bubbling.
There's not a lot of pain afterwards. It feels kind of like if you fell and skinned your knee or if you had a blister. So I think now what you're seeing is Alondra testing her to make sure she is numb all the way around her tattoo. So if you want to just tell us if you feel anything sharp, we'll add some more numbing medicine. But right now she's just checking to make sure she's numb. And our patient says she's not feeling that all seems really numb. And so even though that may look like it's hurting to y'all, it's not hurting our patient, which is perfect because we don't want her to be in pain. We also, before we injected the numbing medicine, we put on some topical cream that helps the area get numb even before we do that. So now she's ready to start her laser treatment. And so if you want to look over here, this is our laser. And we put different settings in for the laser. The laser handle will fire a light that's at a wavelength that attacks the pigment and breaks it up to where your skin can metabolize that pigment out. So the beeping that you're hearing now is our machine calibrating. The total time of treatment is actually shorter than how long it just took us to numb that up. And so, you guys will notice the actual laser treatment is very quick. There's really no downtime, so we'll laser her and she will be back off to work. so Bridget is handing Alondra the handpiece.
All right. Are you ready, Alondra? Okay.
And you can see that light. And we all have our goggles on for eye safety. And I'm going to try to get a really good picture for you guys, because as that light is firing, you can see it firing, it is just breaking up that pigment and what Bridget was talking about earlier, frothing.
So what you're hearing, that snap, is the light hitting that pigment. A lot of the times you'll hear patients say, as treatments go on, the pain is less and less. However, we do numb our patients here for smaller tattoos, so you're not really going to tell a difference other than the sound.
Why don't you pause for just a minute and let them kind of see where you've lasered. If you don't mind pointing out to them the area where you've lasered, where it's kind of got that frothy on it, or that kind of bubbling there.
So you can see here where it has bubbled or frosted, that's where I have already been. So that's kind of how I keep track of where I have been.
Great. You doing okay, patient? She's not feeling anything. We'll get started again. So how long this treatment takes, as I was kind of saying earlier, depends directly upon how large the tattoo is, the area that we need to cover.
So another really important point is that our patient needs to keep this very, very greasy at home. Sometimes our blisters can scar just like any other blister. So a way that we can keep away from making a permanent scar on her is to keep it really greasy. That way her skin can heal naturally and heal a little bit better.
Perfect. So we are all done with her treatment. It was that quick, and we will see her again in a month for her third treatment. We'll keep you guys posted with before and after pictures, and check out our Instagram too. It says, somebody asked, is it keying that bruise and scar forever? No, it will not. Leaving. No. So we will post some before and after pictures on our Instagram. We may already have some up, but the bruising is temporary. Sometimes you can have the white discoloration that we were talking about if you're really, really tan, because that skin is the color God made it. But no, you shouldn't have this bruising for very long. It would heal at the rate of any bruise or blister. And we'll post some before and after pictures, because so that you guys can see what it looks like when the pigment is completely gone. But no, that was a good question. Thank you. So now they're covering it with Vaseline and putting a bandage on it. We would ask that she keeps it bandaged for the next 24 hours, and then after that keeps it greasy with Vaseline and doesn't get any sun and tan. And we will be posting some before and after pictures for you guys. And we will definitely post what she looks like in a month, what her tattoo looks like in a month. We really encourage you guys to call either and ask for Danny or Bridget, one of our cosmetic coordinators, and they can do free consults with you guys and kind of let you guys know if you're a good candidate for the laser tattoo removal and how many treatments and all those kinds of things. So we look forward to hearing from you guys. And once again, this was a laser tattoo reduction. Have a great day.